today's Health Matters, living in the Ozempic era. More than 15 million people currently taking GLP-1 weight loss drugs, and that number continues to grow.
So there are a lot of concerns over the impact that these drugs can have over the long term, especially on women. Joining us this morning to discuss the pros and cons of GLP-1 drugs is Dr. Rocio Salas-Whalen. So good morning to you, doctor. Thanks for being with us.
Good morning. Thank you.
Well, there are so many of these GLP-1 drugs out there. What would you say are the most popular ones, and what really is the difference between each of them?
So I like to describe them like the iPhone. The original was the iPhone 10, Ozempic, and now we're having the iPhone 12, 13. So tirzepatide, which is Mounjaro, and Zepbound is our newest, is our iPhone 17, right? But many more are coming in the market. And it's really what it differentiates them is how effective they are in regards to losing weight and the side effects. Some have lower side effects than older versions and more weight loss.
Okay, you know, the rapid weight loss is a positive result for so many, and that's why so many people want to do it. Some of these were originally treated for diabetes, right? But now people are seeing the weight loss effects. But with that comes the potential loss of something like lean muscle, right? So how do you kind of balance the two?
Yeah, definitely. It's educating the patient that a lot doesn't mean better, right? Actually, they should be losing about ½ a pound to a pound per week. More than that is significant muscle loss. So we want smaller numbers in weight loss. And we should be doing body composition studies to see really what they're losing. Is it muscle? Is it fat? Is it both of them?
Yeah. Well, that's the thing, though. There are a lot of women, especially women in perimenopause and menopause, that are already dealing with muscle loss, with bone loss. Should they not be taking these types of drugs, especially for weight loss?
Yeah, that's not a contraindication to being on this medication. The thing that feeds muscle and feeds bone mass is protein. With a GLP-1, you may decrease your consumption of protein, so we have to be proactive in teaching them and educating them about consuming more protein while on a GLP-1. But they're not a contraindication if they have high body fat mass.
Okay.
So how do you offset the loss of something like muscle or bone density?
Increase the protein in the diet and strength training. Those are like the two parts. I call it your GPS. G for GLP-1, P for protein, S for strength training, your navigation system.
So let's look long term then. What are the potential side effects long term of taking these types of drugs?
If they're not used responsibly and with the right guidance, then definitely patients can develop osteoporosis, sarcopenia, which is severe muscle loss, right? So we want to avoid, and we can avoid that. We have these drugs for more than 20 years now. So the long-term studies, we know what's happening, that it's improvement in people's health. But to prevent the side effects, we really need to educate doctors and educate patients.
How long do people take these drugs, though, usually? What's the time frame?
It's going to depend. I always tell the patient, depending on the reason that brought you to need the medication, that is going to determine how long you're going to be on it. So if somebody has struggled with obesity since childhood and they're in midlife, 40s, 60s, then most likely they will need this medication long term.
Well, what's long term? Like years?
I mean, until death do us part, right? Until because obesity is a disease.
Yeah, once you get off of it, a lot of folks who are on it, they get off of it and the weight comes back.
Definitely, because they lost the weight because of the medication.
Right.
So once they're off of it, the same reasons that brought them to gain the weight are still there.
And I think that's one of the misconceptions that people have, is they take the drug, they lose the weight, and then they're good. But that's not the case.
No, that's the problem, that they see it as an aesthetic medication. Oh, so I can lose weight and just for the dress, for something physical, they don't understand that it's for a disease. It's a treatment for a chronic disease.
Got it. Doctor, thank you for coming in. Your book, Weightless, is available wherever books are sold. Appreciate you being here.
Thank you.